Hello. So what's all this about FoodMarble breath testing, or breath testing in general even? So FoodMarble is a portable breath testing device that's aimed at people with SIBO, IBS and on the website they say certain digestive issues, but which ones exactly I'm not sure. So there's two options of devices. Their entry-level FoodMarble Air priced at £149, and then they've got their premium one priced at £189. So that's the FoodMarble Air 2. And FoodMarble Air claims to be effective for finding which foods are suitable to you and measures hydrogen only, compared to the FoodMarble Air 2, which measures hydrogen and methane, and claims to be effective for finding your foods and monitoring SIBO, which comes with a caveat that any diagnosis or treatment should be performed under the guidance of a doctor. So what's the theory behind breath testing and how useful are these tests? So breath testing is based on the premise that when a carbohydrate, so a sugar, isn't well digested, it gets fermented by the bacteria in your gut, and this produces gases like hydrogen and methane, and these gases are then absorbed into your bloodstream and then exhaled in your breath. So this all seems like a reasonable way to try to measure an intolerance, right? But although this sounds great and it would make life much easier, there are issues. And there are some things that influence the accuracy and reliability of these tests. And I'll come back to this in a bit. So first, what's FoodMarble's process? What do you do? So on their website, they say, 1, you can log your food intake on their app, along with a few other things. 2, after you eat, the app asks you to take breath tests, which is really nice of them. 3, monitor and improve your symptoms. By the way, just to be clear, this is what their website says, not me. So how often should you do breath testing? What do they suggest? Well, their website says daily testing. And, this sounds okay, it sounds doable. But under their FAQ section, I noticed that it says if you can manage to take between 8 and 10 breath tests each day, you're doing excellent. 8 to 10 breath tests a day, that's quite a burden. All those tests every single day. It's bad enough for some people to try and take a pill every day, let alone to fill your day with taking loads of breath tests. But, this may be acceptable to you, we're all different. So they say their device is validated. What does that actually mean though? So they're basically saying that their device has been thoroughly tested and it meets certain standards for accuracy, precision and consistency in measuring the gases in your breath. So you should be able to trust the results, right? Sounds fantastic. Happy days until you look at the studies that they're basing all of this off. So the company's website mentions 2 studies. So they've got one which is a pilot validation study of an at-home hydrogen breath test device, the FoodMarble Air, and this was conducted by Short and Brief, who are affiliated with FoodMarble Digestive Health. So because the authors have a conflict of interest due to their association with the company, there's obviously a level of bias. Therefore, it's important to be cautious and take the results with a pinch of salt and acknowledge that, the objectivity and the quality of the study is likely reduced. So this study has other limitations as well, and these need to be considered, such as it being a pilot study, which is basically a small-scale preliminary study. And these kinds of studies are used to assess things like feasibility of the study. So they're just checking if it's possible or practical to even do a study before actually, doing a larger and more expensive one. Also, they used only a small sample size. They only had 13 people in the final data analysis, which makes it difficult to draw firm conclusions about the accuracy and the reliability of the device. This small sample size reduces the power of the study and it increases the margin for error, which can make, a study pretty meaningless really. And on top of that, the results may not be relevant for the larger population or a certain group of people. Plus, the study was completed using healthy people rather than people with digestive problems, which, means that the findings may not apply to the people who the device was actually designed for. So, to the second study that they mention on their website. This was a validity of a portable breath analyzer, so air, for the assessment of lactose malabsorption. So these researchers were assessing lactose malabsorption, which is different from lactose intolerance. Here's what I mean, just in case you don't know. Because I know, a lot of people often confuse lactose malabsorption and lactose intolerance, thinking that they're basically the same thing. But there is an important difference that you need to know. And also, lactose intolerance is an analogy, by the way. So lactose malabsorption is where the body is unable to digest and or absorb lactose, which is a sugar found in milk and dairy products due to the lack or deficiency of the enzyme lactase, which is needed to break down lactose. Lactose intolerance is where lactose malabsorption causes gut symptoms. A crucial point to know is that not everyone with lactose malabsorption has symptoms of lactose intolerance. So just because someone has lactose malabsorption doesn't mean to say that they're lactose intolerant and suffering with symptoms. Does that make sense? And it's important because dietary restriction of lactose is only required with lactose intolerance, which may be only temporary depending on the cause of it, which is another important thing to know. And it's also worth noting that certain fermentable carbohydrates, such as fructans, aren't digested by anyone because humans don't have the enzymes to break them down. So they end up in the large intestine as food for the bacteria to munch on. Or if you've got SIBO, which is small intestinal bacterial overgrowth, hence it's called SIBO for short, then the bacteria in your small intestine, which isn't meant to be there, and hence the name SIBO, these will munch on the undigested carbs first. But like with lactose malabsorption and intolerance, just because certain carbs are difficult for all of us to digest, it doesn't mean that we'll all get symptoms. Does that make sense? So back to the second study. So this is only a small one as well. So they only used 19 healthy people aged 20 to 40. So the results may not be applicable to people outside this age range and with other gut conditions. And the authors of the study, they mention limitations of the device, such as it not being able to reliably identify the maximal extent of absorption, so the severity of the malabsorption. And the accuracy within the lower range needs to be validated in a larger study, so they want to have more research completed. So you could say that the device has a sweet spot, but what if the readings fall outside it? They also mentioned that the accuracy of the device may be limited depending on the type of substrate used. So for example, whether it's lactose versus milk containing lactose. And they recommend further research into how different types of food affect the results obtained from using the Air device. They raise further important points about how people using the device will interpret the results because it may lead them to unnecessarily avoid certain foods and causing nutritional inadequacies and health consequences. And they also note that the person completing the test needs to share the results with their healthcare professional. The study suggests that the Air device could provide preliminary diagnosis of lactose malabsorption. And notice how they said malabsorption and not intolerance, not lactose intolerance. But their conclusion was reached by following specific protocols to try and increase the accuracy of the results, which isn't practical for the average person to try replicating in their daily life. For example, FoodMarble recommends 8 to 10 breath tests daily. The protocol won't fit around this. How can you do 8 to 10 tests per day whilst getting on with your day? This not only interrupts your day, but it also isn't practical. There's practical issues like when will you actually get to eat if you have to fast for 8 hours before testing, or avoid an activity and exercise for 2 hours before or during the test. And the researchers have used standardised amounts of lactose. So 50 grams are lactose dissolved in water, or they used cow's milk, rather than, mixed foods that people eat daily. And this can affect the readings and potentially lead to false positives. But why is this a problem? So false positives are a problem because they're incorrect and they can make you think that you have lactose malabsorption when really you don't. And with people getting confused, like I mentioned earlier, between malabsorption and intolerance, it could lead to unnecessary dietary changes. By the way, 50 grams of lactose isn't a normal everyday amount. To get 50 grams of lactose, you'd have to drink a litre of milk or a kilo of yogurt. That's a lot of yogurt in one sitting as well. Another important point to note is that both these studies were done in a research environment rather than in real world situations like you at home doing the tests. So the way they done these tests, the way they were completed, the protocols and the preparation leading up to the test and during the test to try and increase the accuracy, they're totally different from how someone like you would use the device in your everyday life. And as a result, people doing home tests will be getting less accurate and less reliable results than the researchers. And they've got loads of limitations and flaws with their studies and devices and all that kind of stuff, let alone Joe at home trying to do the test. Plus, the findings of these studies may be less applicable since they don't reflect real world, use of the device. FoodMarble have other research and they've presented their findings, but again, there's a conflict of interest and a high risk of bias, and this influences their interpretation and reporting of the results. For example, they may be more likely to report positive results, obviously, and they're more likely to downplay the negative results in order to benefit themselves, the manufacturer, the company, or to maintain their relationship with them. This bias can compromise the integrity and the credibility of the study and its findings. So based on all of this, what do you think? Is their device validated, accurate and reliable like they say it is? So that's all about the device. What about other factors that play a role in breath testing? And I'm not just talking about FoodMarble's devices here. This applies to all breath tests. So research has shown that breath testing results aren't always consistent or reproducible. This means that the same person can take the test lots of different times and get lots of different results each time, which can make it obviously difficult to rely on the accuracy of the test. Factors that affect breath test results include things like whether or not you're a low hydrogen producer, which is measured in the device, what the gases the device can test for, the algorithm used by the device or the analyzer, how the test was performed, if the person being tested, if they've got any illnesses, health conditions or previous bowel surgery, medication, smoking, exercise, supplements, what you've eaten, gut transit time, the baseline diet followed beforehand, variations in gut bacteria and function, the accuracy and training of the person taking the sample along with their interpretation of the results, just to name a few. It's quite a lot. And if you want to go ahead with, and try the FoodMarble or any other home testing, breath testing kit, it's obviously your choice. But I hope you found this helpful and this has given you a clearer picture of the potential benefits and the limitations of these tests. And it's important to keep in mind that while these tests can provide some insight into digestive issues, they're not a substitute for professional medical or dietetic advice. And you shouldn't rely on these results as a sole means of diagnosis or for making your decisions about, symptom management. If you're having symptoms, it's always a good idea to speak with your healthcare professional to determine the best course of action for you personally. And also, I should say that SIBO, because FoodMarble states it on their website, that you can monitor your SIBO with their device, although you could try doing the same thing with a different device, different breath testing device, but SIBO needs to be officially diagnosed and treated by your physician, and then for dietary advice and support then you need a dietitian. Just because you can attempt to monitor your SIBO yourself, it doesn't mean that you should avoid seeking medical input. The main line of treatment for SIBO is antibiotics, although dietary changes can help only if you work with a dietitian. And until the underlying cause of SIBO has been treated, then there's a high risk of it returning even after a course of antibiotics. Also, untreated SIBO can lead to nutritional and health consequences because, when you don't know what you're doing and you're trying to adapt what you're eating to try and manage your symptoms, it might not be nutritionally adequate for your needs. But also, as a consequence of SIBO, you can lose weight and you can become low or deficient in certain vitamins such as vitamins A, D and B12. So obviously all this needs professional input to treat, manage and prevent you from hurting your health and well-being. So I hope all this helps. Stay safe and I'll talk soon.